Hello, I'm Jan Leifman.
And I'm Muskan Joshi.
Welcome to MedNews Week Conference, where we feature presentations by medicine's global leaders. Today we have an amazing keynote speaker in Dr. Alok Khorana. Dr. Khorana is the Sondra and Stephen Harris Endowed Chair in Oncology Research, the Vice Chair in the Taussig Cancer Institute, Director of the GI Malignancies Program at the Cleveland Clinic Lerner School of Medicine of Case Western Reserve University.
In today's presentation, Dr. Khorana discusses the rise in young-onset colorectal cancers.
Did you know that Dr. Khorana is the author of the Khorana Risk Score for venous thromboembolism in cancer patients?
What an accomplished pioneer in the field of GI oncology.
So let's tune in and learn from this global leader.
So let's start with some good news first, which is that the incidence of colorectal cancer since the 1980s has steadily decreased. And this decrease was especially accelerated in the late 1990s with the advent of universal screening colonoscopy procedures for people aged 50 or older. And that remains associated with quite a steep decline in both incidence and mortality, both in men and in women. You can see in the graph on the left, the steep decline in male and female incidence, as well as the decline in male and female mortality. And in the graph on the right, you can see compared to colonoscopy rates, as they went up, you see this acceleration in the decline in colorectal cancer. So that's the good news. In fact, more than good, it's great news. But what this is masking is that when we look at that prior graph, which shows the steep decline in colorectal cancer, that decline is driven primarily by a decline in colorectal cancer in older people. And here we are defining that as sort of older than age 50. If we separate out younger patients, in fact, this good news masks an alarming rise in incidence in colorectal cancer patients. You see below here the graph on the left for incidence, graph on the right for mortality, men in blue, women in red. And you can see that for both incidence and mortality, there's been an increase in incidence for both men and women, and starting to see an increase in mortality somewhere around the mid-2000s, and certainly more accelerated in the past decade or so. If these rates persist, we expect that colorectal cancer is now already one of the leading causes of cancer-related death in men. Women are a little bit lesser rate of mortality, lesser rate of incidence, but potentially that could also increase. Looking at the same data a different way, if you look at sort of the proportion of cancers, right now, 11% of colon cancer and 18% of rectal cancer, so nearly 1 out of 5 rectal cancers occur in people under the age of 50 years of age, or 50 years. And by 2030, so by the end of this decade, we anticipate that in people less than 50, the incidence of colon cancer is going to double and the incidence of rectal cancer is going to quadruple. And you see this translating into median age at colorectal cancer diagnosis on the right. When I started out sort of taking care of cancer patients, it was clearly a disease of the elderly. The median age was around 72 years. Most patients were in the range of 70 to 80 years. And now in the last 5 years ago, we see this sort of steep drop in median age from 72 down to 66 years. And that's driven primarily by the decline in older people and then the rising incidence in younger people. And if these rates persist, we may see even further declines in median age for new colorectal cancer diagnosis. And this certainly adds to the worry about this alarming rise of young onset colorectal cancer. It should also be noted that this phenomenon is not restricted to the United States. In fact, it is global. The names of these different countries are really small in this graph, but just sort of taking in the whole graph, you can see that for most countries, the ticks are upwards, indicating an increase in incidence. The few bars pointing sort of south are those countries where there's not an increase in incidence. And even here, the story is not quite that clear-cut. For some reason, men seem to be more affected. Looking at just one country outside of the United States, these are colorectal cancer incidence rates in India. where rates are increasing from 0405 to 0608 to 0911 and so on. But the increase is driven primarily by men in India, in whom the rates of colorectal cancer have increased by about 50%. So already you begin to see sort of, yes, there's a decline in colorectal cancer, but there's an increase in younger patients with colorectal cancer, but this increase is not consistent across all countries in all subpopulations. And so that leads us to the question, what is driving this phenomenon of young onset colorectal cancer? Can we identify environmental factors or other factors that may be playing a role? And over the next section of this talk, I'd like to address some of what we're learning about this phenomenon. I think whenever you see in public health an increase in a specific type of illness, particularly an illness that used to be for older people, the immediate impulse is to look at environmental factors, so diet and lifestyle. And there have been now, as you can see in the second column here, multiple different trials, epidemiologic studies, I should say, not trials, cohort studies that have attempted to address or identify diet and lifestyle factors that could be associated with young onset colorectal cancer. Some are fairly obvious. We've known for years that high consumption of sugary beverages, a sedentary lifestyle are associated with an increased risk of all types of cancer, and you see that bearing out here as well. But others are not quite as obvious. Elevated triglycerides, for instance, have been shown in this study to be highly significantly associated with young onset colorectal cancer. Whether that's driven by the triglycerides themselves or whether the elevated triglycerides are a risk factor or a surrogate for a poor diet is unknown. Obesity certainly has been associated with many different types of cancers and remains strongly associated with young onset colorectal cancer. The Western diet has been incriminated in both cardiovascular and cancer incidence and remains associated. And one factor that may explain the spread of young onset colorectal cancer outside of the United States is a more widespread adoption, sadly, of Western diet across the globe. Smoking, processed meat consumption, alcohol intake, these all seem to also be strongly associated with an increased risk of young onset colorectal cancer. In contrast, higher consumption of fruit, vitamin C, some use of aspirin, folic acid, beta-carotene, vitamin E, and a higher consumption of vegetables. So essentially a healthier diet appears to be associated with a decreased relative risk of early onset colorectal neoplasia. And so this sort of graph summarizes, this is not just one study, these are several studies that have been put together in this one slide by Patel and colleagues in a recent issue of Lancet Gastroenterology and Hepatology. Now, it's also important to consider what about diet and lifestyle can affect colorectal cancer tumorigenesis. And in fact, several factors have been postulated. We don't have hard evidence for all of this, but these factors may include exposures that occur as early as conception or even before conception, as IVF, for instance, is increases in prevalence. There have been certainly changes in term of birth weight. In infancy, there have been changes in breastfeeding or not, in antibiotic exposure for young babies. Growth and development has undergone some changes over the past few decades. Childhood lifestyles have also undergone a change. Diets are different now than they used to be. Exercise is less. Smoking, alcohol consumption may start at younger years. And chronic health conditions are more common now in adults, including obesity and inflammatory bowel disease are more common in adolescents and young adults. And so all of these factors, including maternal lifestyle and diet as well, can potentially add to the effect of these different exposures on colorectal cancer neoplastic progression. There's no question that, at least in the United States, that some of these factors are driven by a race and ethnicity. In this analysis that our group conducted, that was just published last year by Sunil Kamath and several of our colleagues, we looked at baseline characteristics of patients with early onset colorectal cancer as well as older onset colorectal cancer. This was about 1 million patients, 100,000 of whom had early onset disease and 900,000 had older onset disease. And Black patients definitely had the worst median survival compared to white patients. They're also more disproportionately likely to develop early onset colorectal cancer. You can see 15% of early onset was Black patients as compared to only 11% of late onset or usual onset. Hispanic patients, 8% versus 4%, whereas white patients, less likely, 70%, still the majority, 70% of early onset compared to 80% of older onset. Sadly, early onset patients were more likely to present with metastatic disease. Nearly a quarter of early onset colorectal cancer was metastatic compared to only 17%. You can see median survival was longer, but the advanced state certainly does not help with outcomes. And this is graphically represented here, where you can see Black patients have sort of worse survival than anybody else. And this actually occurred regardless of insurance status, which again needs more analysis. So to summarize, patients with early onset colorectal cancer are more likely to be Black or Hispanic and to present with stage 4 cancer. Black patients with early onset colorectal cancer showed worse overall survival compared to white patients in all income subgroups, even with private insurance. So if we can identify other epidemiologic factors that would be helpful in sort of understanding this phenomenon. These are brand new data that were just presented this weekend at AACR, but by one of our colleagues here at the Cleveland Clinic, Blake Buckhalter, who's a postdoc in Stephanie Schmidt's group. And he took a unique approach to understanding the epidemiology of young onset colorectal cancer with trying to identify hot and cold spot identifications. So using this sort of method known as geospatial clustering, the strategy was to find localized areas where you see more or less young onset colorectal cancer so that those areas could be analyzed better and interventions could be undertaken. So if you look at all stage incidence for young versus average onset, young is on the left, average is on the right. You can see overall there is a southward shift of regionality. So young patients are more likely, the darker the red, the greater the incidence of young onset colorectal cancer. This is incidence by county between 14 and 18, which is the most recent data that we could get. If you look at left versus right, you see that the patterns are different. So the counties that are redder on the left, indicating young onset disease, are different than the counties that are redder on the right. And more counties in the south are more likely to be involved with young onset disease. We actually further age stratified this into less than 35, 35 to 49, less than 50. And if you look at sort of 35 to 49, that pattern is very similar to sort of the usual pattern. So if one extreme is less than 35, the other extreme is 60 and over, it still behaves not so much categorically as it does continuously. So as you get closer to older patients, so the 45 and 50-year-olds are more likely to behave like a 55 or 60-year-old. But the population of patients that's less than 35 seems to have very unique hotspots, including one right here in Ohio and the Great Lakes region, and also some clear cold spots, so areas where you'd see a lower incidence than you would expect. The cold spots here are identified in blue. The hotspots here are identified in red. And you can see they're different depending on the age of onset. But if you look at the two extremes, A up here and F down on the right, the patterns obviously are quite different. Hotspots for older patients are concentrated sort of in the southeast. Hotspots for young onset colorectal cancer are more in the north, especially in the less than age 35, the northwest, Midwest North, and northeast. And so this definitely needs a better understanding of what are the factors in these areas that are driving this. So our first explanation indicated sort of, identified young onset colorectal cancer mortality hotspots. This is actually the first reporting of cold spots for young onset disease, which are also helpful to understand. And after adjustment, shifting is basically upwards to northeastern Appalachia and Ohio. And we really need to understand sort of better patient level data to understand this better. But I think this analysis is actually a very important first step in trying to grapple with this phenomenon of young onset colorectal cancer.